Hello, dear listeners. Today I'm going to share another very interesting case of mine. It's a case of a cervical pain. I will also discuss with you today the cervical issues and the muscular issue, how to recognize these issues in your practice with the symptoms, and what are the important symptoms or the remedies which you should consider while prescribing in your practice. Nowadays, cervical issues are getting very common in our practice because of the posture issues or sitting position. Let's say people are sitting whole day on their computer, or stress, aging. Of course, you are losing the bones because of the aging. That's why I would like to talk about this very important topic. So first, I will share this case with you. It's a case of late 20 years old lady. She came to me with a cervical pain. She was complaining that she has this pain for many weeks. She said there was a tight stress feeling in her neck, and the pain traveled down her arm into the hands. She was experiencing this pain from neck all the way to this two fingers, fourth and fifth finger. She also felt numbness in these fingers. The pain was worse from motion. She has this predominant numbness and tingling in the fingers, in the whole arm. She was already taking painkillers, and she have been prescribed by other homeopaths some remedies, homeopathic remedies, but nothing was actually relieving her pain. I gave her a remedy called Kalmia, which is very common in my practice. Kalmia, why Kalmia first? Because Kalmia has this shooting neurological pain that go from neck downward into the arms, especially along with this ulnar nerve into the fourth and fifth fingers with the numbness. Exactly what she described. Kalmia has this symptom travel from up to down. Laxus has the symptoms from down to up. This is the very common, keynote of Kalmia. Whenever you see that the symptoms are going from upwards to downwards, then always think of Kalmia. This is a very important keynote of this remedy. Do you know which other remedies has this pains or the issues moving upwards apart from laxus? It's ladum, conium, and silicia. But gelsemium also work wonderful in those cases. Remember, conium has this special affinity in the C1, C2, and C3. Same with the gelsemium. And gelsemium has this special affinity in cervical issues. Keep in mind, conium is also mentioned in those conditions or paralysis or the weakness which start from the legs and move upward. This is a very typical symptom of conium. I also use conium in cervical issues, especially when the C1 or C2 or C3 is involved. The conium has a very special affinity in those vertebrae. So some of you might think, why not Paris? Because Paris also has this shooting pain which goes all the way to the fingers. But Paris has this numbness of arms, heaviness in the neck and shoulder, stiffness as well. Even they have this strange sensation that the joints or that vein is swollen. That swollen feeling is a very typical of Paris, which I don't see in this case. But of course, Paris is also one of those remedies which I prescribe very commonly in cervical issues. I will share definitely a case of Paris cordifolia with you. It's a very important remedy when it comes to the cervical pains or cervical region issues, especially when the pains travel from a neck to the arms or the fingers. It's also very common. It is basically these two remedies are very common in my practice when I'm prescribing in cervical issues. Now let's talk about how do we know it's a cervical pain or not just a muscular pain. Muscular pain stay localized usually. They are worse from strain. I mean, they if you move or you do some physical work, it get worse. And if you massage or take a rest, and then you feel okay. And in cervical issues, or you can say the nerve root compression issues, in those cases you see that the pain starts from the neck and radiate all the way to the shoulder, arms and fingers, depending on which cervical vertebra is affected. And taking rest or massage doesn't help those issues. They are constant there. Now let's talk about different cervical vertebrae, how you can recognize in practice that which vertebra is involved in this pain or cervical issues. Keep in mind that there are 7 cervical vertebrae in human body. When C1 or C2 are involved, patient usually complain about a pain in the head or occiput. They often complain that they feel dizzy if they move. They have this constantly dizziness or vertigos and drowsiness sometimes because of this heavy vertigos. They cannot move their head. In those cases, you think of cocculus or conium. These are the wonderful remedies. I usually prescribe those remedies, but in C3 and C4, usually you see that the pain start traveling from neck to the clavicles, or the base of the neck or the shoulders, or it goes upwards in the head. Then you must think of gelsemium. Gelsemium do have this numbness sometimes, or this dullness, heaviness, weakness as well. When the C3 and C4 are involved, the pain is usually also goes to the eyes sometimes. Then you must think of gelsemium or spigellia or sanguinaria according to their symptoms. Of course, sanguinaria has this right-sided issues and spigellia has this left-sided issues. And when the C5 and C6 vertebrae are involved, then you usually see the pain radiates from shoulder to the arms. And then you must think of gelsemium as well and some other remedies. If the C7 is involved, then the pain radiates from shoulder all the way to the fingers. And this is the typical pain or the symptom when there is a problem in C7. When the C7 is involved, I already spoken about Kalmia, Paris, sometimes Licia and calcarea floors are very common remedies which I prescribe in those cases. But of course, you individualize the case according to their symptoms. When the C7 or T1 thorax region first vertebra is involved, usually the patient cannot lift or grip anything because of the weakness in the hand grip. And of course, the pain travel all the way from neck to fingers. Then, of course, Kalmia and Chininium self is one of the top remedies in those cases. And of course, there are few other remedies which I usually give or prescribe in cervical issues, like radium bromatum. It's a very useful remedy in cervical stiffness. It's Rastox-like symptoms, but its keynotes are pain better from motion, which is typical of Rastox. But the Rastox issues are not very deep, but if you see the symptoms are very deep and destructive, where the bone deformity starts, then Rastox will not help. Probably it will only relieve temporarily. So then you must prescribe radium bromatum because it goes more deep into the case. It's a more deeper remedy. Then there is another remedy, fluoric acid. Fluoric acid is used in those destructive bone conditions, caries and degeneration. Osteophytes, of course, which is a very common pathology in cervical issues. Then, of course, calcarea floor. It's a very common remedy which I prescribe in cervical issues, especially when I see the destructive condition of the bone. I often prescribe in those cases where there is a osteophytes or cervical bony changes, destructive changes. If patient complain about stiffness, then cephalinum is also one of the remedies which I prescribe in advanced stages of cervical issues. And of course, I give this remedy in the base of the prescription. Let's say I start with the cephalinum and then I prescribe the remedy, let's say Kalmia or Paris or lachesis or staphysagria, according to the symptoms, of course. One remedy which you must not forget is staphysagria. Staphysagria is one of the very top remedies in my practice as well when it comes to the pain in the spinal issues or cervical issues, with, of course, its typical mental symptoms. Dear listeners, this was today's talk. I have discussed a very interesting case of Kalmia. Of course, it was a small case, but with a very important keynote symptoms I have discussed. And also I have discussed the other remedies which I often use in my practice when it comes to cervical issues, and my strategies, of course, how I deal with those cases. If you want to contact me or you want to have a consult with me, please do write me. See you next time with another case. Bye.